All right. Hey Blaine, just give me a thumbs up if we're good. Just gonna
Good to
give
go,
this a
man.
couple minutes. Guys, we're just gonna give this a couple minutes to get going. Just give us a couple minutes. We're just gonna get let Facebook and YouTube and everybody who's logging in a second or two to kind of log in. Hang with us. We're gonna be starting in a couple minutes, okay? Couple more minutes. We're just gonna wait for the algorithms to get going. Okay, great. All right, so I can't see any of your comments. Maybe Blaine will. So, guys, we're just gonna go. We're gonna do about 20 or 30 minutes, and I just want to say welcome to all you guys joining us. I know that we have primarily acupuncturists and Chinese medical practitioners joining us. We do have some patients joining us, and I also know that we do have some doctors joining us. So welcome. I'm Dr. Andy Rosenfarb, and tonight we're going to be talking about eye strokes, specifically how they're related to COVID. Now, this is not a session for or against. We're not talking at all about the vaccines. The purpose of this presentation in this session tonight is just to let you guys know, that there is a risk factor. I've seen a huge uptick over the summer for eye stroke cases directly related to the COVID vaccines. Some of the cases I've seen are related to COVID, but again, we're not telling everybody to, what to do. I just want to make this aware for you guys, for your patients, if you see this. And then we're going to talk about some treatment strategies and what you guys can do to help your patients. All right. So the first thing I wanted to talk about is just that. It's been my observation over the past 6 months that we've had, again, I've observed that we've had a lot more cases of eye strokes, a couple of brain strokes, but mostly eye strokes. And most of these cases have been within the first week or two after getting the vaccine. Now, I've got a lot of questions about that as to what vaccine it is. It's all over the board. So I've had patients overseas who've taken the AstraZeneca vaccine. I've had patients take the J&J vaccine. I've had patients take the Pfizer and the Moderna. So my belief system right now, and I'll tell you guys what is actually evidence-based and what my theory is or my observation is. So what I've observed is that it's more of a pre-existing disposition. So I want to say it's not the vaccine. It's just more there are people who have certain risk factors. I'm going to talk about that in a minute, how you can actually screen for that. So as we know, a couple of complications of getting vaccinated or getting COVID is this process called an inflammatory cytokine storm. Okay, the inflammatory cytokine storm is what happens when our immune system goes berserk. The virus gets into our body, or the vaccine, and the immune system just reacts almost hyperactively. And part of that reaction process is inflammatory process. We also see things like blood clotting, in some cases bleeding. Of course, different people are going to have different symptoms, but for the purposes of this conversation, what I'm really talking about are blood clotting and subsequent hypoxia. Right? We know the red blood cells that are clumping together and forming the clots, those are what deliver oxygen through our body, right? So if the red blood cells are clumping together and forming clots, then we have clots moving throughout the body, and we don't have free red blood cells moving around the body to transport oxygen. So that increases the risk, that clotting increases the risk of strokes or branch occlusions, or eye strokes as we call them. So just want to make you guys aware of that idea, that we've seen that. We're not 100% what's going on or why. This is more of just like, hey, this is an observation and this is what I want you guys to look at. So the first thing that we're recommending to all patients right now, whether they're vaccinated, whether unvaccinated, whether they've had COVID or not COVID or thinking about getting the vaccination, is to really look at their clotting factors to see what their risk factors are when it comes to clotting, because that is the big problem that we're really seeing right now. And if you guys want to do research, do all the research you want online. You'll find a ton of research, both on clotting that can be caused by COVID and the vaccines, but also specifically the clotting that can happen in the eyes and in the retina. I will post in the link down on our Facebook group this, but go to Google Scholar. Don't take my word for it. Go to Google Scholar, go to PubMed, and look for these peer review articles and research studies that are showing this. So it's real, guys. I'm not making it up. So how can you assess for your risk? I'm glad you asked. There are 4 tests I want you guys, so get a pen if you're taking notes here. The first test that's going to check for your hyperclotting is called a D-dimer, D-D-I-M-E-R. The D-dimer is the most popular test right now for COVID, and it ranges from about $10 to $50 if your insurance isn't going to cover it, which in my opinion is totally worth it. But your insurance will probably pick it up if you can get your PCP to make a recommendation and get this blood test done. It is a blood test. They're going to draw blood and they're going to do a D-dimer test. And what that does is it checks to see if you're susceptible to clotting. Now, the other 3 tests we're going to use is the second one is prothrombin. That's another test to check for bleeding disorders and or clotting. Right? It's very, very common blood tests. The third is the sedimentation rate. That checks how viscous and thick your blood is. All right. So the sedimentation rate is the third one. Then we have the fibrinogen. All right. That is another test that we use for clotting to see if you have the susceptibility to clotting. Now, those are the main 4 blood tests. I do recommend for patients who are really interested, if they want to get like a 1, 2, 3andMe to get like genetic testing to see if you have like some of these genetic factors towards clotting, I think that's even better. So what we did is I did the 1, 2, 3andMe, and I did the D-dimer, sed rate, and fibrinogen. That was enough for me. The prothrombin is also good, but if you can get all 4, great. Definitely the D-dimer, the sed rate, and the fibrinogen. If you're so inclined, definitely do the 1, 2, 3andMe. Not only will that tell you about your blood clotting risk factors, but it's a great test to just look at your overall health risk factors. So I don't get any kickbacks from the company, but I do. I really like the 1, 2, 3andMe testing. So again, what happens when we get either the vaccine? For some people, look, most people are going to be okay with this. But there are some people who are at high risk, and this is the population we're talking about, because most people just don't know, right? So what happens again when we get this cytokine storm, we get dramatic elevations, in inflammatory processes, blood clotting, and subsequent hypoxia, again, low oxygen to the cells. So what's going to happen is that's going to result in neurovascular damage, neuro the nerves, vascular the blood vessels. We're going to have things like, in this case, eye stroke or brain stroke, or you can have hemorrhages or something like that. We've seen, rashes on the skin. There's a whole host of stuff that can happen. But again, we're really talking about, occlusions and eye strokes over here. We also have seen patients with macular degeneration and diabetic retinopathy have spontaneous bleeds, which is the same process that happens. So in Chinese medicine, for those of you guys who are TCM practitioners, the patterns we're really looking at 4. Again, do your pattern diagnosis and see what's going on. But the 4 main patterns that I've seen related to these conditions are the following. One is obvious qi and blood stagnation, right? Anytime we have something like that clotting, there's going to be a stasis or a sludge that accumulates of blood and qi. The second pattern we're going to look at is more of a liver kidney yin deficiency. So if there's an underlying dryness of the body, of course, the blood is going to be a little drier and stickier, which a modern interpretation will reflect in the fibrinogen and sedimentation rate. Okay, so again, we know if somebody's yin deficiency underlying, that's going to be, in Chinese medicine, an elevated risk factor for these clotting situations. Also, liver yang rising, right? We have hypertensive patients We have patients who tend towards headaches and nosebleeds or insomnia or anything that we know that's affiliated or associated with the signs and symptoms of liver yang rising. For sure, they're going to be at more risk for these types of injuries. And then, of course, the fourth is more of a combination of phlegm and blood stasis, right? So we're going to have the combination of not just chi and blood stasis, we're going to have an element of dampness in there. And that'll be, of course, people who have a little bit more in Chinese medicine. You're going to see slippery pulse. You're going to see maybe a greasy tongue. They're going to have more spleen, chi, pancreas insufficiency syndrome with your signs and symptoms of that as well. So what do we do? So now we identified kind of a functional biomedical understanding that inflammation, blood stasis, hypoxia is going on. We've looked at some of the branch patterns along with the underlying patterns and maybe even a constitutional analysis of what's going on. And so we're really trying to get a picture of both the root and branch, the patient's underlying condition, and then how are they reacting to the COVID vaccination or if they've got COVID. So what we want to do then is look at treatment strategies. Okay, so let's start with some acupuncture points. So these are points that I have used, and the information I'm giving you guys now are from the book Ophthalmology in Chinese Medicine. It's coming back into print. Those of you guys that have it, use it. It's a great resource for these specific conditions. And also, I'm aware that it's not available, and some people are charging like $1,200 for it. But I'm in touch with the company, and we're working on getting a whole new fresh batch. So if you're interested, reach out to me, and I will put you on the waiting list for that book. So Acupoints, point prescriptions. So again, take some notes. If you guys are here, if you have the book, you can check that. We're looking at bladder 1, bladder 2. Bladder 1 may bruise a little bit easier, so you can kind of thread bladder 2 down to bladder 1. Chiho on the lateral third of the lower border. Yu Yao, right? That's a good point in the middle of the eyebrow. I like that point. And then gallbladder 1. Okay, those are the local points that I really like for this. You can also, if there's some heat that you think may be coming from the stomach, which is really common that we're seeing with the COVID vaccines and COVID, it seems to enter the Yang Ming and you have like some heat resonating there. You can do stomach 2 up to stomach 1, thread that. We've had some good results with that. Also, if we look at more distal points, we're going to look at gallbladder 20, right, to get rid of some of that wind, move the lymphatics. Liver 4, liver 3, Li4, that combination, the 4 gates. Spleen 6, stomach 36, spleen 10 too, to kind of move the blood. Li11 for sure, and P6, pericardium 6. So that's the combination that I've been using for my patients. Also, scalp acupuncture, if you know that system, highly recommend that. And also the microacupuncture 48 system, for those of you guys who are familiar with that system. We have specific protocols for that. Those of you guys who've taken the course have access to those protocols. If you are interested in taking that, again, reach out to me. We do have that full course and the basic course online. And this fall, I might be doing another either live or online training for the foundations, but I'll talk to you guys more about that. And feel free, again, to reach out to me if you're interested. With Moxa, we're going to do Moxa on spleen 1, right? Spleen 1, we know if we do Moxa classically, you can either do direct Moxa or just use a Moxa stick to warm spleen 1 to help stop with bleeding. I also like doing Moxa around the navel, and I like doing Moxa around the eyes. Those of you guys who have the book Healing Your Eyes with Chinese Medicine, maybe you're aware that we do snail shell Moxa, where we moxa around the eyes, or you can even just kind of take the Moxa stick. I actually use the Electro Moxa pen now. I really like that one. It's infrared heat over the eye. The reason I use it is just I have a lot of patients who are sensitive to the smoke of Moxa, and if it's kind of like around the eye, I use that. It's expensive. I think it was like $1,200 or $1,300, but I'm using a little bit more of that now in clinic. But certainly can send patients home with a Moxa stick. Just have them like kind of be careful. The other thing we're doing with patients is hyperbaric oxygen. For those of you guys who've been following me, the last year and a half have been very, very, very interested in doing clinical research. We have 2 hyperbaric oxygen chambers They're highly, highly indicated for a lot of conditions, primarily stroke. So brain stroke, eye stroke, long COVID, acute symptoms people are having. We're having really, really good results combining Chinese medicine acupuncture with hyperbaric, and it really is resolving the bleeding very, very rapidly. So if you have any patients that you're treating and they might have access, or you know of a hyperbaric oxygen chamber in your area, that might be something that you might recommend your patient to do. Definitely something that's going to be useful for them. And if you don't know much about hyperbaric, reach out to me. I can have a conversation with you, but go to our YouTube page. My YouTube channel, Dr. Andy Rosenfarb. I have 2 videos right now. I'm going to start making some more this fall on hyperbaric, and specifically hyperbaric for vision. But again, it's very, very useful for this eye stroke scenario that's going on. Okay, so that's acupuncture. Chinese herbs, for those of you guys who do Chinese herbal medicine, we're looking at individual herbs like san qi, right? Yunan Payao is really good to stop bleeding. Very smaller amounts of Da Huang, right? Rhubarb. Typically in larger doses that's used for constipation, but it's really, really good in smaller doses, like 3 to 5 grams, to help with getting the blood circulation going. It's really good for that. I also like D-Long, lumbricus, the earthworm. What it has in it is lumbrokinase, which is a proteolytic enzyme that breaks down the proteins. Now, with that, I'm going to talk a little bit more of that in a second, but I'll talk about it now. What that does is when the blood cells clump together, the red blood cells, and form a clot, there's a protein between them, right? So the protein is what bonds them together. And D-Long has lumbrokinase in it, which is a proteolytic enzyme that breaks down that protein that makes the red blood cells stick together. Also, nattokinase is another proteolytic enzyme, or you can use protease. If that's all you have, just make sure your patients take it on an empty stomach. Otherwise, it could act as a digestive enzyme. So you want it on an empty stomach, probably about an hour before meals on an empty stomach to break down that protein. Also, I like danshen a lot, Chinese salvia. And of course, ginkgo biloba for the microcirculation to the eyes and the brain is really, really useful herb for that. So those are kind of like Chinese and Western herbs and supplements for that. Other Chinese herbal formulas that we might look at are, of course, shui fuju yutang. That is one of my favorite go-to formulas for this, and you can modify it a little bit. That, of course, is for qi and blood stagnation in the chest and upper body. And there are certain modifications. If you guys have the Bensky formulas and strategies, there are certain modifications for stroke, and you can add herbs. I like adding things like D-Long to it. Not so much if it's raw. People have raw formulas because it gets a little nasty, but certainly granules or tinctures, people can add D-Long. Tong Qiao Ho Shui Tang is another really, really good formula. Again, that's Tong Qiao, Q-U-I-A-O, Ho Shui Tang. I'm sorry for you guys who speak Chinese and have it dialed in. My pronunciation isn't great. But again, if you guys want to comment and just let me know if you missed any of those. Both of those are for qi and blood stasis, all right? Those are my go-to formulas. Of course, if there's the liver yang rising thing going on and people are having headaches and ear ringing and tinnitus, which is common, I've seen a lot of that, we may want to add or look to formulas like a modification of Tianma Gotengyan. That's the Gastrodia and Encaria decoction, which is one of my favorite formulas to use clinically. Then the formula that I like to use when there's a combination of blood and phlegm is Ditan Tang, D-I-T-A-N-T-A-N-G. So that's a really good formula when there's a combination of blood and phlegm stasis. So if you see a little bit more of a damp presentation, dampness and blood stasis, you see more of maybe a patient with spleen qi deficiency or pancreatic insufficiency, in dampness in your clinical presentation, look at that formula is a possible thing to consider. Regular supplements, we're recommending, of course, your vitamin D3, your vitamin C, zinc, which we all know are good antivirals. I also use herbs like androgaphitis, which is it's a Chinese herb, really, really good Isatis is a really good. I think Health Concerns has Isatis Gold, but I really like the Androgaphitis for COVID. I'm getting really, really good results with that. Is an antiviral. We talked a little bit again about the lumbrokinase and the nattokinase to help break up the blood stasis, specifically again the protein that's causing the blood clotting. And again, just please remember to take that on an empty stomach. Otherwise, it'll just break down the protein in the food that you're eating. I'm also really big on CBD, right? You guys, we have our own product called Canavision, and it's a full spectrum CBD, but we also have broad spectrum CBD. For patients who are having issues or complications as a result of the vaccines or their acute COVID, I am super mega dosing patients on CBD. They don't mind it because they're kind of sleeping all day, but we're recommending minimum of 200 milligrams a day. I have patients taking upwards of 500 milligrams a day. Really helps with the pain and the inflammation. So CBD actually acts as a steroid without the negative steroid side effects. It's such a powerful anti-inflammatory, and this is really the part of from an herbal standpoint that we're looking at to really help with the inflammation that's caused by the cytokine storm and or from either COVID or the vaccinations. Then, of course, we're also recommending omega-3 DHAs to help thin the blood a little bit and help with the nerve repair and regeneration. And, of course, we always recommend probiotics and prebiotics. The probiotics, of course, you guys know acidophilus. We have a new product that I'm going to talk to you guys about at another time. It is a red marine sea algae prebiotic that we're using to help patients build their immune system. Traditionally, it's really, really good for female issues like PCOS and dysmenorrhea. It kind of thins the blood like that. So women patients who have really good, before COVID, I was using it for that and getting really, really good results. It's also really good for skin and really good source of omega-3 DHAs, but I added it to my treatment regimen right now, again, because it does help with pain and inflammation. So we know that blood stasis thing is definitely a factor. So we're using the red marine algae is a source for that. So I'll be talking to you guys more about that in weeks to come. But if you're interested in adding those prebiotics, the red marine algae, I'm taking it now every day just as part of my health prevention strategy. So prebiotics, probiotics. Those are you guys, Chinese medicine, the Piwei Lun, treatise on spleen, stomach, gut health, mas importante. Those of you guys who do functional medicine, you know quite well the value and the importance of having a healthy gut microbiome to maintain a healthy body and healthy immune system. So that is our quick little sesh for you guys. If you have any comments or questions, or you want to drop in the comments in the Facebook thread that's down here, please feel free to do so. Again, this is recorded, so you guys are going to be able to watch this at your convenience. We're going to have it in the Facebook group. We're going to have it in the microacupuncture group. I'm also going to post it in the Dr. Rosenfarb Acuvision patient community group, and then we're also going to have it on our YouTube page, Dr. Rosenfarb. So you guys can join us for any of those viewing. If you want to watch this again or you want to share this, please do with any of the colleagues or practitioners. We hope that you found this useful, and thank you for your time, guys. Have a great evening, and we will talk to you soon.